Now let's talk about kind of like what all we should in terms of what should we take and what should we apply in terms of creams and what should we avoid during pregnancy. So well balanced diet, is for most important. Yes, during pregnancy normally a woman has to take a diet for two, one for herself and one for the baby, and but equally burning the calories is important. Like balanced diet which is rich in protein, most importantly protein. I don't want to promote the animal protein. There are people who are vegetarians. Yes, the protein is important. You can have a good source of animal protein or a plant protein. The diet rich in milk, the diet which is rich in iron, most importantly. That's why most of it our Indian women are deficient in iron, and because of iron deficiency you have anemia, and there are consequences secondary to that. And even normally even a woman have lack of glow because of iron. And most importantly, another thing aspect is the thyroid abnormalities, which are very very frequent. That means like if somebody has that issues, always have your thyroid regime properly done. Now seasonal fruits, like most of us ignore these things. Seasonal vegetables and fruits is something which is very important, that should be taken during pregnancy. A normal diet regimen is important. Gentle exercises or gentle stretching or like brisk walking is equally fine, but it depends on which trimester a woman is, and that can be dealt. She can be in a consult a gynecologist regarding that. And most importantly, if we talk about the skincare, what should we avoid and what should we use? All the skincare which are rich in parabens or which are rich in like formaldehyde or aluminum chloride, they should be avoided. And you should always use a sunscreen, but not the chemical sunscreens, because as I said, one of the condition which happens in pregnancy is tanning of the skin or chloasma or melasma. So we don't want to treat it, but we want to prevent it from further worsening. So what to do is always use a sunscreen which is a physical sunscreen. So what are physical sunscreens? The sunscreens which are rich in zinc oxide. So such sunscreens should be encouraged during pregnancy. Apart from that, it is important to hydrate the skin. Always use a good moisturizers which are rich in shea butter and which are rich in like some kind of a little glycerin is equally fine. A lot of good ingredients, to some extent paraffin it can be given, or which can be given to hydrate the skin. And these are and hydration is something which is very very important.